Hi, everyone. It's Dr. Ozzy here. Welcome to the More Than a Pretty Face podcast. Hi, guys. We are back today for another episode. I'm actually so excited about this week's episode. Hey, how are you?
Good. How are you?
Good.
Tell us why you're so excited.
Because we're doing viral TikTok beauty trends, and they are just so outrageous. I'm always so surprised. Mm-hmm. I'm like, where do people come up with this stuff?
I love it.
Is it just to get views? I don't know.
I don't know. It's really entertaining.
It's really entertaining. It's really funny. So I'm excited to do a fact or fiction.
Yes.
If it was on TikTok, we'd say cap or
no cap.
No cap. So yeah, what's going on with you? I don't see any coffee, no matcha, green tea, whatever it is that you.
I have coffee. It's just I have it in my own cup today.
Oh,
no
okay.
Starbucks.
It took a while today for me to get. It seems like it was a busy start to the week.
It really was.
I'm still trying to recover from our surgery day on Friday.
Yes.
And it's Tuesday.
Yeah.
But so what's going on with you? Do you have a beauty or a blemish?
Yes, of course I do. Let's start with our blemish since you already brought up our surgery day.
Oh yeah, that was intense.
Oh my gosh. Okay, you guys. I walk in to the surgery room and this poor patient has a hole in her head, like literally her whole forehead.
Well, did you see it before? Because she had a gigantic tumor in her forehead.
I did not. I walked in and
the
I'm
hole
like,
was after I removed her skin cancer. You know, we normally don't see these extreme cases. When I was in training, certainly we, had a lot of volume, especially at the VA. People would come in with these huge tumors. I'm talking like the guy had half his back infiltrated with skin cancer and was too afraid to go in and get it checked. And most of the time in our practice, people are really diligent. They'll see something, it's not quite right, they'll come in. But this poor lady, she walked in with, I think, bigger than a golf ball size tumor on her forehead. We had to take off half her forehead.
Yeah, I don't think
Friday.
Patients realize too that it's not just what you see. There's cancer cells underneath the skin that aren't visible to the naked eye. That
it's like the tip of the iceberg. You see that on the surface, but skin cancer actually goes way deeper into the skin. So sometimes it can just start out looking like a pimple. It doesn't heal because what happens is cancer takes over the skin. It sort of eats away at it, and it could just keep going. And spread. So this little thing that you're ignoring, it's always safer to get it checked so that it doesn't grow and take over. And that's why, we don't have to take as much skin out.
I do think, though, that most people don't realize that you can have this small little cancer that is very big under the skin. And I don't know, it's been a while since I've seen one that big. So when I walked in on Friday, I was like, whoa.
But we closed it. We closed
my gosh. Seamstress, like best reconstruction ever.
I really find those challenging cases very rewarding and very gratifying, being able to take a hole like that and move skin around, take skin. We took some skin from in front of her ear and patched it on, in addition to moving some skin from the scalp. And I love that we can do this under local anesthesia. I mean, we didn't take her to the operating room.
No.
Plastic surgeon would have taken her to the operating room, put her under general anesthesia. I mean, all the love for the plastic surgeons, but dermatologists do a lot under just local anesthetic.
Yeah.
The greatest invention ever.
Yes.
Otherwise, it would be a shot of whiskey and a towel to bite on.
Yes.
And that would be pain control.
Yeah. No, that's not very well managed. But no, it is really rewarding. But I guess I considered that my blemish, just to walk into that.
Yeah.
My beauty would be, so I have fall decorations up. I love October, November, like those are my favorite times of the year. It was always my mother's favorite time of the year. And so I have these lights, just white lights, but I do have the option to change them to multicolored. But I don't. I just like the white, and it's got little pumpkins, and I have them around my mom's ashes. And one night we left, and when we came home, the lights were different colors. And my husband's like, I swear I didn't do that. And I'm like, I didn't either. And I believe you, but let's see if it happens again. And so we turned them back to white. And one night it was just me and Remy up. And I said, if that was you, Mom, make them turn like another color again. And sure enough, in the hour, I'd say, not even an hour, the lights changed to multicolor again. Yeah.
No.
Yes. So my mom was there.
Oh my gosh.
I loved it. It was like her little, I'm here. I'm still with you.
With the lights. That's so sweet.
I know. I loved
I
it.
do believe in that. That spirit, you know, there's something, there's spirits in the universe. Don't you think? Like things that happen and you realize those things happen for a reason, whether it's that or something just, you know, cute little story like that. I love that.
So that's my beauty. How about you?
Well, my blemish is a couple of days ago. You know, my son, now that COVID is, you know, not as intense and there's a lot of social things, my son has regained like new friends.
Oh, good.
And he's so excited. He actually has friends.
He's the cutest.
Yeah, he like missed out on that for the past couple of years. And so he was at his friend's house, and of course, boys. He calls me crying, and there's nothing worse than getting a phone call from your kid that's crying. I'm like, oh my God, what happened to you? He is so wild. Boys are just a different breed.
Yes.
So of course he had like fallen off a skateboard. He wasn't wearing a helmet.
Oh, of course.
Fell off a skateboard. Like his skin was missing, and the mom was freaking out. She's like, well, call his mom. She's a doctor. She's a dermatologist. And normally I keep like a first aid kit in my house, but because of all his injuries, it's been like very scant. So I had to run to the office, run to his friend's house, and poor thing, I mean, he was just sitting there. His hand was all bloody, dripping in blood on their breakfast table, and I was like, oh my gosh. And so I did the whole bandaging thing, but you know, a lot of people use hydrogen peroxide, right? Because this woman was like, oh, I have hydrogen peroxide. I got Neosporin. I was like, oh, no, like none of that. Those are usually what people think to use on wounds. But hydrogen peroxide is actually very caustic to wounds, and it can impede wound healing. And Neosporin is like, people use that for everything. They, use it for pimples. They use it for cuts. Well, it has neomycin in it, and a lot of people are actually allergic to neomycin, or if they're not, they will develop an allergy to Neosporin, which has neomycin in it. And when you get an allergic reaction, it actually delays your wound healing. It can complicate things. So we had a little wound 101 talk, welcomed or not. But you know what I love using on wounds, especially kids, because my son's deathly afraid of pain. Like it's already hurting. He's like, no, don't wash it. Don't da-da-da. Especially when it comes to me. I love hypochlorous acid.
Okay.
And it's a great antiseptic. It's not caustic to wounds. I actually often recommend it for my eczema patients too, because people with eczema tend to get secondary bacteria on their wounds that then causes their eczema to get even worse. So spraying the hypochlorous acids, it's not painful, it's more gentle, and he did great. And we just used, what I had was CeraVe healing ointment, and we used that. And we had to wrap it because it was like literally all up and down his arm. So I've been doing, I've been the wound nurse, which doctors are not the best at, because we're not usually the ones that do it. You guys do a phenomenal job. So Yeah, so it's been interesting.
Yeah, I know. Usually you bring him into me.
I know. Well, one, it's hard to treat your family members because he doesn't see me as a doctor. He sees me as my mom. And there's that, it's a different relationship. So when he's with you, he's just on his best behavior. He trusts like what you're doing. So anyways, so that was my beauty and I guess blemish.
Aww.
My beauty is we're here recording a podcast for you guys.
Yes.
Thank you guys so much for your loyalty and for listening to us. I can't believe so many of you guys tune in every week. So I want to thank you. Your support means a lot to us. And if you find this podcast helpful and valuable, share it with a friend. Be sure to follow us on Instagram at More Than a Pretty Face Podcast. You guys are the reason why we record for you every single week.
Yes.
Despite our very busy, practice, we try to make time and bring you valuable, honest, unbiased information. So thank you guys for following along.
Yes, thank you.
Thanksgiving feast is just around the corner. So whether you're the party planner or an attendee, I have just the thing for your eyes the morning after. iGlow AM is a multitasker, a lightweight concealing peptide serum that hydrates and brightens the eyes with a cooling tip to depuff those eye bags. Of course, it's formulated with SPF 50 to protect the delicate eyelid skin against UV damage. For podcast listeners only, get 20% off your iGlow AM on AziMDSkincare.com. That's AziMDSkincare.com with code November20. I love to see your glow up, so don't forget to tag me in your stories at Skin by Dr. Ozzy. So let's get to it because I'm really excited about today.
Okay, so we're doing the viral trends, and I just really have to start with this video where she's talking about washing your face with Head & Shoulders
Dandruff shampoo. Okay, let's check it out.
You spend a lot of money on skincare products. Just hold on. Just go buy Head & Shoulders and wash your face with it and see what happens. I have been using the Walmart version of Head & Shoulders on my face since I was in middle school because I had a dermatologist tell me the zinc in dandruff shampoo is incredible for your face. Never had a problem with my skin, always had clear skin, and it wasn't until I stopped that I started getting all of these breakouts on my chin. I started trying to use the fancy stuff because people were sending it to me for free. Never had worse skin in my entire life. 3 days ago, I threw everything away and started using my dandruff shampoo again. Skin is already clear. Or clearer. It's going to take some time. Just try it.
Well, she's not wrong, that's for sure. Head & Shoulders has zinc pyrithione in it. And zinc pyrithione is great at killing fungus, yeast, bacteria, which a lot of times play a big role, in the skin. It's also anti-inflammatory. Now, some people can tolerate just Head & Shoulders shampoo or the generic, dandruff shampoo, but it also has some other things like fragrance, and some of them have a cooling effect like menthol. So really it's designed for the scalp, and it can be harsh for sensitive skin, but it does work as an antibacterial, antifungal cleanser. In fact, people who have certain skin conditions, like if you have seborrheic dermatitis, which is when you get little, flaky red rashes in your eyebrows or around your nose or around the mouth area, that's caused by oil production and yeast, a natural yeast that lives on our skin. But in some people, that yeast is in large quantities and it feeds on the oil, breaks it down, and you get a rash. This works quite well. But again, it's designed for the scalp skin. So I would suggest getting a bar soap with the same ingredient. There's one by Vanicream. It's called Z-Bar, and it has the zinc pyrithione. It doesn't have fragrance in it. I think it's more gentle. So if you do have sensitive skin, you might want to be cautious and maybe not use that because it could cause irritation. But a lot of people can tolerate it. Actually, it's also great for scalp pimples because a lot of people get breakouts of their scalp, and dandruff. Obviously, it's designed for dandruff. But yeah, so it's not a bad hack.
Yeah, I like it. Okay, let's see. Our next one is dermarolling. So not too much sound. What is she doing here?
So this is Propolis, which is a great it has a lot of benefits. It's actually made by bees and extracted from honeycombs.
Okay.
And it's antibacterial, anti-inflammatory, and it's a great natural substance. Oh boy.
No.
This is the derma
Now
roller.
you would roll it into your skin like that?
You know what? That looks so painful. To derma roll your lips. Your lips are so thin and delicate, first of all. So I can't imagine that being very comfortable without numbing cream.
No.
So I think what she's trying to do is cause a little bit of injury to the lips. And that causes swelling and inflammation and certainly gives you plumper lips. It can also allow for other products to penetrate better because when you derma roll that area, you're creating these little microchannels. And that allows skincare products or lip balms or whatnot to penetrate deeper. But look at this. Then she goes in, and she uses her finger in the jar to put on her lips. Now, what if she has bacteria on her finger or in the jar because she's dipped her finger in there multiple times with those long nails?
I'm not a fan of any of this.
So infection, just like your skincare can penetrate deeper, bacteria and yeast can also penetrate deeper. So be really cautious of this. I would not recommend it. I think it's too risky. Plus those derma rollers that she has, they're like $10. And after the first or second time, those needles get dull. So then they're not really able to penetrate the skin at that 90-degree angle that you want it to. And it'll start kind of tearing on the skin. And that's the issue with at-home derma rollers. The needles get dull. The needles can get bacteria and infections, in them. Whatever it is you're putting on after has to be clean or sterile.
And I don't think a lot of people
She's
realize
sticking her finger in the jar.
Exactly. That's what I don't think people realize, that your finger in the same product every day, like just under our nails, we have so much bacteria and germs that is now in that container.
Yeah, I'm not a huge fan of jars. They could be really convenient and nice, but if you are going to dip your finger, make sure it's really clean and make sure you're brushing under your nails with soap. And then you want to use the back of your fingernail to get the cream off instead of going, like this.
Yeah.
Of course, if you're listening, you can't see, but
Yeah.
if you're listening,
like
check
this,
us out on
not
YouTube. I'm doing a demo of how to stick your finger in a jar. But yeah, you want to use the back of your nails. But even then, you don't want to double dip. You want to make sure your fingers and your nails are clean when you do that.
Okay, so my favorite, is this video here.
Use duct tape to remove blackheads. Can you just use Biore strips? Absolutely. But this was just something that I saw online. I'm like, that can't work. I tried it and it works. Not as well as Biore strips, but you know what? If you're on a deserted island and you got duct tape, you want clean pores, you're gonna remember this video. What you're gonna do is make sure that first your nose is super dry and as clean and oil-free as possible, because you need the stuff to stick. You're gonna tear off small strips. Gently place them over your nose. Take another and really get it down in there. This is a good look for me, right? Smooth them down. Make sure that you have good connection with the tape and your skin. And then you're going to just kind of chill out for about a minute. Let it sort of set in and get in there. And then what you're going to do is slowly remove the tape. Inspect. It's crazy.
If you're on a deserted island, I don't think you're going to be
Worried about your pores.
worried about your blackheads on your pores. You're worried about using duct tape for something else.
Yes. But the adhesive on the duct tape, I mean, wouldn't that cause more irritation in the long run? Like, it doesn't make sense to me.
Yeah, I mean, you bring up a good point. He says it's not like Biore pore strips, but it kind of is.
So it's the same adhesive?
Well, that's how pore strips work, right? You put it on, and that's why he says make sure it's clean. You don't have oil on the skin because you really want the tape, the adhesive, to stick to the skin. And a lot of people think that they are cleaning their blackheads off their nose, but a lot of times they're just ripping off hairs.
Oh, yeah.
It's sort of like waxing. That's what pore strips really can be similar to, just waxing. It takes everything off the surface of the skin. So I'm talking dirt, debris, hair, anything that is kind of lying on the surface of the skin. It doesn't do a great job of treating blackheads, though. Blackheads are deep in the pores, right? So they're built up of oil, debris, dead skin cells. And the stuff is like cement, and it's really deep in the pores. And the adhesive is really just great for superficial stuff. You know, I know when you rip those pore strips off, you see all that stuff on the inside, and you're like, ooh, like it's so clean. You could have probably just double cleansed and may have been fine. Although double cleansing doesn't get rid of the hairs. So if you look closely, a lot of times you'll see little tiny hairs. And that's really what it's pulling off. Blackheads, again, have this stuff in them that is literally like cement. So you need salicylic acid. Does a great job for blackheads. I love the Clarify pads with 2% salicylic acid because salicylic acid is oil soluble and it's able to really get inside the pores and dissolve that cement. It's that stuff that's really tough. And I find that to be a much better long-term solution because even if it did, clean out your blackheads really well, they still fill up again. So you need some sort of maintenance to keep them clean. And if you struggle with clogged pores or blackheads, then salicylic acid is a great treatment for that. Or retinoids also do a great job just because they do renew our skin cells and they prevent the clogging of the pores. So those are much better options. If you have sensitive skin, then I don't know. I would stay away from pore strips. It might actually, the adhesive might irritate your skin. You might get rashes. It may disrupt your skin barrier. And so
That's what I was thinking. That's instantly where my mind went.
But I remember being a teenager and those Biore strips.
Yeah. I
They
never
were just
used
so
them.
gratifying, like just taking that stuff off and it looks so clean. It's like a baby's bottom after you do it. But.
I have never used them.
Oh, really?
Yeah.
I used them actually when I was really into skincare when I was high school. So I love them.
I was a tomboy. I didn't care.
Maybe because I had a lot of hair on my nose because in general I'm very hairy. So I love the fact that it like took off all my little villus hairs.
Well,
Last one.
this
Let's take a
last one I have here.
Gorgeous girl with a pore vacuum.
look. Oh, that's me.
Pore vacuum. You posted this, and I just needed to talk more about this. The way she's suctioning her lip off looks painful.
Oh, you can use these. They're called lip plumpers.
The lip plumper is so much easier.
So, yeah, not a good idea, guys. When you're first of all, lip skin is much thinner than face skin. It's only like 7 layers. It's just really thin and delicate. It's more sensitive, and you're just pulling on that.
It
You're
looks
just
so
stretching
aggressive.
the skin like that. Like, come on. So what she's trying to do is create this negative pressure that causes blood flow to the lips, right? And that's what causes swelling and makes the lip fill up with fluid, and it looks fuller, obviously, because there's more water content there.
Short term.
Short term. It doesn't last very long. I would highly advise against this. I think it's very traumatic. It can really damage the collagen that's in the lip. It can cause irritation and the swelling, bruising, which can lead to broken capillaries in the skin. So definitely a fiction there. Instead, I love the lip plump pout 30.
Yes.
And that works really well. It lasts for about 4 hours, 2 to 4 hours, and it has hyaluronic acid in it. It's clean.
So clean.
And it just formulated with a little natural peppermint oil.
I have one in every bag, every purse,
So if
my
you
work
really
bag.
want to plump your lips, you don't like needles, don't use a pore vacuum.
No. But
Yeah, not a fan of that trend.
literally, your lip gloss is amazing.
Yeah, and I love that it has SPF 30 in it.
That's my favorite part. Like
Yeah.
that's the biggest thing for me. The plumping is just,
Yeah, the
that
Pout
additive
Plump
bonus. And it doesn't just plump, it gives you like a rose pink color.
It
It's
brings
my
out your
favorite.
natural lip skin tone. So yeah, those were great. I really find it very entertaining. If you guys see something outrageous, be sure to send it to us at
Yes.
More Than a Pretty Face Podcast on Instagram. We love to hear from you. And if you're listening to this, take a screenshot, share it to your stories. Until next time, guys, thanks for tuning in.
Bye.
Bye.